Yo, how is it going? Welcome to the third installment of Laser My Face. So this is gonna be a third part of the vlog series that I'm doing, and I'm currently having a mask on. Reason is I already have done the procedure and I'm currently healing from it. So my face is full in scabs and all kinds of pus, but you are not going to see that. How am I gonna go about this? Well, I'm gonna tell you today about the story and a little bit more detail of what exactly happened and how it went down. And then in a week from now, I'm gonna upload the fourth part, which is gonna be a compilation of me healing. I'm gonna have a clip of every day, morning and night, and I'm gonna go about the healing process and everything. But today is for the past. So, all right, let's get into it. So it was during COVID when I was looking for a way to get the cysts out of my face, because after having all the research done, I came to the conclusion that is the only way to get rid of them, because they would, I would squeeze them out or they would just go by themselves, but they would always come back. And there is no literature that tells you they are gonna go away and stay away. Nope. In fact, they're actually always saying it's gonna come back. Reason for that being is that you have some sort of a sac which is embedded in your skin deep down there. And that sac, yeah, he can empty, as I said, but it's always gonna refill and then reactivate the cyst. So I visited a few doctors and none of them wanted to cut it out. They didn't really give me a reason, and a few of them would actually get mad why I would ask them. Uh, they would actually get mad for me just asking why. One of them would say, because it's your face and nobody wants to tinker with your face. Then I went to the hospital and the hospital did the same thing. I'm probably gonna make a whole another video for the hospital story, so stay tuned for that. But TLDR, I just was not satisfied with the answer I got from the doctor, and I didn't even raise my voice or anything, but I guess I made a somewhat disrespectful comment by saying, also, you're not gonna help me now because you wanna go on your break. I did not say this out of thin air. It was something that his assistant pointed to, having a break or whatever, but it doesn't matter. Whatever. This story is a whole video for itself. But yeah, so he reacted very badly on this, or she reacted very badly on this, and then yeah, totally flipped on me. So that was an experience. And then I find this one doctor, and I get there, and I'm seeing him for the first time and everything, and he was surrounded by his lovely assistants. It was like three very beautiful young-looking ladies, and I would get the feeling that he was flirting with them big time. So whenever I would ask something, he would always look at them and say, "Oh, no problem, I got this, and I'm the best," and all kind of stuff. And I really just want to give him the benefit of the doubt, but that is absolutely the vibe that I got from that situation. So, anyways, I talked to him and I say, "Yeah, so what can we do? Can we cut the cysts out and the sac and everything?" And he says, "Yeah, no problem. That is everything is gonna be very easy and smoothly done, and I should not be worried about anything." So I wait for an appointment because, of course, it was COVID. The appointments took forever. I don't know. I think like I had to wait another 2 months or so before we could get to the surgery. But yeah, so in between the waiting time or during the waiting time, I was looking up all kinds of cyst removal, and I must have made a playlist of like 100 cyst removals, and I watched the craziest cyst removals that you can imagine. Like people would get whole tumors and whole like apple-sized, fist-sized cysts out of their face. And there was a doctor, I really forgot her name. I should give her mad props because after all that I've been through, I know that she is an absolute real beast in doing these things. But she would be able to cut like a very small little hole or like a small little cut in your face and still get all of this out and get the sac out and clean it up, sew it together, and there was a yeah, no residue. You would not know that there was a cut or anything. So I figured, yo, after all this stuff that the doctor said and me watching how this gonna go down, on the internet. I thought, yeah, it's gonna be good. I'm very confident this is how we're gonna do it. So the day of the surgery comes, and I get there, and I talk to the doctor, and he seemed very nervous. And in fact, he told me I was in a room one on one with him, and there was like none of his girls around. And I go, so yeah, let's talk about the surgery and stuff. And then he actually asks me like, why should I cut it out? And I go like, what? What have we been talking about, right? And I go like, I talk, I don't, I talk out of my ass at that point because I don't like he hit me out of nowhere with this question. And eventually I say my quality of life has been really really bad, and I just want it to end. Not my life, of course, but you know, the situation with having the cysts. Because they would always get reactivated, especially the one that I have, which is right here. I think you can even see a little bit through my mask that there is a, yeah, big hole. But it would just get reactivated every day, and it would just be a mess on my pillows, and I had to put towels on my pillows, and then the towels would get messed up, and everything was just messed up. It was horrible. And of course, going out in public was always crazy. People would look at my face. I see it in their eyes. I see how they're looking at it. I would put a bandage over it, and then I would put all kinds of salve and stuff. And it just looked horribly stupid because it was such a big one, like a big patch. And then, yeah, my confidence pretty much went down the drain. So he looks at me, and as I said, he was very nervous, and he goes like, "Okay, I will do it." And he could actually say, "Okay, I can do this," because that's not what he said, but that's how it sounded, right? So I think he was scared, and he never done this before, but he kind of didn't want to admit. Anyways, so I go there, I lay down on the thing. None of it was like giving me any professional feeling anymore. It was like a some sort of a makeshift operating table. I lay down on it, and then I had to wait another 15 minutes or whatever for him to come back with like anesthetics and stuff. So there was two of his assistants coming in the room, and then they were talking about something, and just looking at me, and as if they're saying, "Oh, this is the guy that we're gonna do the thing, and we never done it before, so let's learn something." And anyway, so they inject me with the anesthetics, and the injection was really painful. And I see the scalpel that he's using, and I'm like, okay, so this is actually happening. So after this, I'm gonna have a scar in my face. Let's get it. So he starts cutting, and I noticed the scalpel that he used. Of course, I was sedated, or like the area was numb, but I still could like feel the tugging and the scalpel not being sharp enough, or rather just scratching. It was just scratching, 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 and not being sharp at all. Like I would hear my skin ripping and not being cut open, right? So that got me really, really nervous. And then uh, then a few more minutes in, he goes like, "I can't find it." And I go like, what do you mean you can't find it? I didn't say that, but I was under shock anyways. Like also I did feel pain a lot during the whole thing, so the anesthetics, as much as they helped, they didn't really help at all. But yeah, you definitely feel all the pain. So he goes like, "Yeah, I can't find it, blah blah." And I go like, "It is so big." Did never speak at all. Like I'm just gonna say what I was thinking. It was so big. Like how can he not find it, right? So he cuts in there. He cuts in there, and more and more blood. I feel like a very warm sensation running down my face, and then she had to always like swap out his assistant always had to like swap out the gauze and stuff. And so they keep cutting, and it went on for like minutes, and then he goes, "Ah, there it is." And I'm going like, what the fuck, holy hell, how big is this hole gonna be, right? And as I said, like I really much got the feeling that the scalpel he was using was not sharp at all, and he was just scratching and trying to find it, and making a big hole in my face without any success. But eventually he found it, so he got it out. So they had to burn. They used like some sort of a burner, and to burn the wound so the bleeding would stop, right? And then it was done, and he shows me what he cut out, and that was really nasty. It was like thumb piece kind of thing, and it was like all white and with hair would come out of it, and it would look like some sort of like a beehive kind of formation. I was asking like, can I take this with me? He said, no, we have to send this to the lab. I was like, oh, sad. But yeah, so that happened, and then what I noticed, what I realized was that he didn't even like patch it up. He actually just put like a cloth thing on top of it, like a gauze, and then he just put a plaster on top of it, and that's it. Nothing else. And I was like, okay, so the scar is not gonna be that big, right? Like after all of this thing, maybe it was just in my head. Maybe it's gonna be all right. So he patches it up, and then 1 week later, the plaster comes off, of course, and I'm able to clean the wound. By the way, he didn't tell me anything about how to clean the wound or like how to take care of the wound. And I should have been like putting on cream or Vaseline or anything of that sort. The only thing that he told me was, I'm gonna need a laser, and the laser is gonna cost me more like 2,500 something like that, some stupid number. I didn't even listen. I immediately tuned out because it was something that I could never have afforded at that point. And he goes like, yeah, you're gonna need a laser thing to deal with the scar, but you can also like he's trying to sell me like immediately his service, right? His lasering. But we can also try with like a micro needling, and that only costs 500 per session, and blah blah blah. And I go like, yeah, okay. So there's too much information for me right now. Like I'm actually weirded out, scared, satisfied at the same time because it's out. But yeah, it was just a like a mix of. It was just horrible. So the thing comes out off, the plaster comes off, and then I saw the scar, how nasty it looked, right? That's the thumbnail, by the way. And I go, oof, that's a big one to swallow, dude. So the worst thing though was that immediately I noticed that there is still some pus coming out. So anyways, the area was like breaking out with like new cysts immediately, and like pimples and cyst like formation, and the wound looked all horrible, and the flesh around it would look like it was melting, and then it would like draw strings, and it was just a really really nasty gnarly sight to look at. So I actually freaked out, and I was like, wow, what the hell did he do to me? And so I call and I make an appointment, of course, because it's COVID. I have to wait like another 2 months. But I could go visit there and get new flusters from them, from the reception. And so I did. But I did not get to talk to the doctor because I don't know, for whatever reason, I was waiting for him and he just would not come out of the room. So I was like, okay, what the hell is going on? I was like, but you know what? It's not gonna change anything because I just have to take care of the wound now. And then I talked to the receptionist, and this was like more than a week after now, and she goes like, yeah, you need to put Vaseline on and stuff. And I go like, this is the first time I'm hearing this. And I also was too stupid to only look at the cyst removal videos on YouTube and not like how to take care afterwards, right? But really, I was like trusting him so much that that was a thought that I just did not think about, and I was like, it's gonna be good enough. But it was too late because I realized it so late that he didn't sew it up, that he didn't patch it up, right? Or maybe I just didn't register it early enough. I was so stupid during the time. I don't know what the fuck I was thinking. Honestly, I was in a very bad mood, anyways, and depressed, and then this happened, and wow, it all just compound to be like just a whole big pile of shit, right? So I realized it was a mistake. And then the biggest issue was that I have not touched upon yet was that during the whole thing he actually cut through a nerve in my face, and that nerve made it so that my face was in this area, all of this area was completely numb, and that went on for like, I don't know, like more than 3 years or so, and I was scared as fuck. I actually looked up a lot into nerve healing and stuff, and it is so that nerves can heal if the cut that was done was like really clean and just small. They can actually like not reform but like reconnect, but it's just gonna take a whole while. And exactly that happened, and I'm so thankful that it happened, because like I don't know, you guys cannot imagine that you suddenly, like, first you look like a piece of shit, and then you lose the half of your face, of like the feeling. It was so crazy, dude. I would touch it and I just would not feel anything. It was just numb, just completely numb, for like more than 3 years. So that was a crazy, crazy, crazy experience for me. And then at some point, the feeling came back. I noticed, like, I can't remember what exactly happened, but I was like on my bed or something, and I like touched it. I think it was my hair, or like a pillow or so, and I noticed like a sensation, and it felt like when you inject anesthesia, and then the first few seconds, like this tingling sensation. So it would like start getting numb, but not really yet. So in this like transition phase, that's how it suddenly felt, right? And then I would like touch my skin very lightly, and I could actually feel something, and I was so overjoyed. It was amazing. I was like, wow, it's like the feeling is coming back. And then it would actually stay like this for like many months, not being more, not being less though. And I was happy with that, but it was actually even more weird, because now instead of just being numb, it would be like a weird sensation, right? Eventually now, man, I can feel everything again. Yeah, I don't feel like there's a difference. It is so amazing. But yeah, so during the healing, I noticed that I would still get breakouts, or like, as I said in the first video, I never had acne like in my face, right? It was just the cysts that would break or like rupture, and then it would form more cysts underneath and like all throughout the cheek. But these kind of persisted. So whatever he got out of me, he did not like got all of it. And for how big the wound was, he could have easily gotten everything out, I believe. But like he didn't. So I was left with like a few cysts still, and then that wound, and that was like 5 years ago. Now the cysts have mostly vanished, and that is crazy, because usually they just last forever. But I had to like squeeze them out, and I did a very, very good job of trying to get all the sac out, the stuff myself. It must have been like baby cysts and not too deep yet and stuff. So I think that's why. But a few of them have stayed for sure. So on both of my cheeks, I have two cysts left that always get reactivated. So yeah, 1 or 2 months during the healing of my right cheek, I noticed on the left cheek some weird sensation, and I got really paranoid. I'm like, oh no, I don't want this again. Is this happening on my left side as well? So I go to him again, and I'm talking like, yeah, is this same happening on my left side? Like, what am I doing here? And he immediately goes, yep, we have to cut it out. And I was already like, completely messed up and very irritated, and I was mad at him, but he was the only one that would touch it, or like, try to get rid of it. So I had to stay with him, of course. And also he was the only one that knew what he was doing, so I really had to stay with him. And afterwards I went to other skin doctors, and they also said the same thing. They're not going to touch anything. I have to go to the guy who did this, because he's the one who knows what he did. But anyway, so I make another appointment, and it took like another month or so to get the appointment, and he cuts my left cheek this time. And the weirdest thing is, so he uses like a cut like this, in this direction on the right cheek, and then a cut in this direction on the other cheek. So the same thing again, right? But this time I think I got it confused, left and right. It doesn't matter. But this time on the new side, he also didn't patch it up, but he somehow managed to like make it tighter, and he used like another fluster that he could like tighten up. And I was so mad. I was like, why didn't you do it in the first thing, or whatever? And man, whenever I would ask something, whenever I would ask him anything in regarding of like why would he do it like this, and or whatever, he would get so mad and pissed, and every time. And then he would just leave the room, and I would be left with like his assistants, and then they would have to like finish whatever I was like talking to with them. it was absolutely horrible experience for me, and I was so mad at him. But I was so stupid to not sue him, or I don't know, like to not sue him, or just stand up for myself, I guess. But what could I do? I was in his hands, right? The damage has already be done, and I don't know anything about this, so I'm actually like absolutely in his hands, and it was just a terrible situation. But yeah, so he cut out the thing on my right cheek. Again, he showed me what it was. It looked almost similar, but this time it was like more fatty. And then I realized way afterwards, though, he actually, what he did then, he cut out more fat than cyst. For whatever reason, maybe the fat was, you know, with the cysts or whatever. But that left me with a dent in my cheek, as you can see in the photos that I left in the first and second vlog. So overall, horrible situation. The scar was much better looking, but it was such a nasty scar, and then like an indentation and everything, and man, it was a horrible experience. So yeah, horrible. He disfigured me. Like in my opinion, what he tried to do was that was his first time. He did not know what he was doing, and then he was like, you know what? I'm just gonna upsell him a laser afterwards, because laser could be fixing it. But the laser would be so expensive. Like in his words, one sitting of laser was 2K. He also said there's gonna need multiple lasering. Like who the fuck am I, man? Do I have that much money? Like what the fuck? So whenever I would say the lasering is way too much money, he would immediately go like, yeah, you can pay just half the money and get the micro needling done and stuff. So I feel robbed. I feel like I was an experiment for him, and then he realized he's not gonna be able to make it right, so he's just gonna try and sell me a laser. And yeah, he was lying to me as well. So then he told me to put on a cream daily, and I did it for 5 years. It is this one. It's called Epiduo Forte. It has like some sort of acid on it, and that makes sense for me to, for acid to even out the skin, right? But I talked to other doctors, and they said, no, this does not nothing. This does nothing for you. But he said this is gonna get rid of the scar. What? This does nothing for me. The only thing that I've noticed after using this for 5 years every day was that my skin has become like silky and shiny, but the scar would look exactly the same and nothing would have happened. I don't know how much longer I should have taken this for the scar to be gone, but the scar is a huge fucking scar anyways, so I don't know, man. I was just too naive and stupid, and the times were crazy anyways. It was just a mix of very bad everything, and here we are now. I was so mad, and he really got the idea of me being mad, right? He goes, yeah, you know what? I'm gonna help you. I got this injection. It's very new. No, first he goes like, oh, let me take a picture of your scars, and then he's gonna go on like some sort of a convention, and he's gonna take the picture to the convention and talk to the people there, and then he's gonna come back to me and say whatever he finds out how we can deal with the scar. And I was like, wow, he's actually gonna, he actually starts to care about me now, because after such long time, he suddenly feels bad about it, right? Because man, it looked so disgusting as well, this scar. So I showed him. I was like, I can't. From this angle, it destroys me every time I look at it and stuff. And so yeah, he did that, and then a month later he comes back and he goes, okay, so what we can do is I have a injection here. It's like RNA, and it's like a DNA injection, and it's gonna help the scar. It's gonna remove the scar. And I go like, what, really? I have never heard of this, right? So I go, okay, sure. And he goes like, yeah, let's go into the other room, and I'm gonna inject you. And I go like, right now? He goes, yeah, sure, let's do it. And I was like, so happy, right? And then he comes with the syringe, and that was so painful. Oh my god! But basically it was like a thick needle, and he goes into my skin, like very deep into the scars and into the scar tissue, and like over and over again, and he just injects. It goes in like 20-30 times each side, right? Afterwards, I felt completely beaten, right? My face was all swollen and bleeding and stuff. But I was happy. I was like, yo, this is gonna help me maybe. but I didn't really understand how it works. Anyways, I came home immediately. I researched, starting to see how this works and stuff, and there was not too much information, honestly, but it can help with like light scars or something, and it's gonna reactivate collagen synthesis. That's actually what you want, right? To have the collagen work again and produce more, for your body to produce more collagen in that area, so the skin gets reformed. However that works. I haven't seen any effect of that syringe yet, but we are doing the laser now anyway. So then the procedure was done, right? And before I got home and stuff, we talk, and he says, yeah, it's gonna take a while until you see the effects and stuff. And I go, okay, sure. And then he leaves the room, and his assistant comes in, and she goes like, okay, that will be $200. And I go like, what? He never said a single word about this being $200 or being any money at all. Like, he did not mention a single time that I have to pay anything for this, right? And I go like, no. Can you call him back into the room? And then it took me like 10 minutes to call him back into the room, and he goes, and he comes in, and he looks at me like with a so weird face, and he goes like, yeah, you think this is for free? You think everything is for free? I go like, what the fuck? What? And you know what happened, man? I said, I'm not paying for this. I left the room, and he just stood there in the doorway or whatever. I didn't even look back at him. I said, I'm not paying for anything, and I just left the room, and I left the building, and I never came back. Nope. I was so mad, and I'm so done with this guy, man. So that was the last time I saw him, and now we are here, as I said. A crazy story for me, anyways. Big roller coaster of emotions, and yeah, now I have to pay big monies for lasering. But as I said, guys, so the procedure is done. I have been through the laser, and this might very well be the first sitting out of many. I don't know how many there are gonna be, and I hope there's gonna be very few, because I don't have any money for more. But I'm gonna keep you guys up to date. So currently I'm making a little clip morning and evening of how everything is healing, and I'm gonna talk more about the clinic that I'm going to. It's like a beauty clinic and stuff, and you're gonna see more and all about it, how it's healing. And of course I'm gonna keep you up to date after a month as well, and after 2 months. But stay tuned for that. That should be all for today, and don't trust any doctor, guys, before any procedure, especially if a scalpel is involved and they're cutting into your skin. Go to good old Google and just research everything you can. Get a second opinion, and then the last option you have is gonna be the scalpel. In many cases, it's gonna be the scalpel, because as I said, the cysts, you can only remove them completely if you cut open the skin. But if you do that, make sure you're with a professional, with somebody who has a record of doing so greatly and good, and then you're gonna be good, because there is people who can do this in a very, very nice manner, and really clean, and everything is nice and patched up. Just look it up on YouTube. But this should be everything for now. So thank you for watching. I'll see you next time.